Good morning, everybody. Dr. Willardsen here in the beautiful city of Newport Beach, California. And today we've got a great show again. Today we're going to talk about lots of topics discussing, patients who are in need of major reconstruction of their mouths. And I'm grateful to have my good friend and support here, Memo Hea. And Memo is he's the guy that does everything, and so together we're going to kind of go through some of the questions that we get on YouTube. Go ahead and hit that subscribe and like button. Helps, of course, with the algorithms on YouTube, so that we can continue to grow our community, grow our channel, and help patients or people who are in need of these sort of reconstructions to have a place to go to gain information and to approach their situation with a real good wealth of knowledge and understanding of the ideas and the concepts out there. There's a lot of material, there's a lot of marketing, there's a lot of different techniques, a lot of different doctors with different training. And so for an informed patient to be able to make a good decision on their case, on the process, what's going to be best for them long term, that's really our end goal here, is to help patients really have a good foothold of what it means to have their mouth reconstructed. So last week we talked with one of our patients who had kind of fallen into a situation where, unfortunately, he got lost in the system, and as a result spent a lot of time, money, heartache, headache, years. And, you guys, I don't know if you watched the live stream from last week, but we were able to, talk to our patient, what his experience was, and you could see the effect and the emotional drain that it was on him. And this is what we know to be true. It truly is an emotional drain to go through the process and have it not go smoothly. It's hard enough to go through the process when it does go smoothly. Not that it's hard, it's a process. It's when somebody loses all their teeth, to restore them back to normal natural function, to where they can smile and eat and laugh and feel like they are back to how their life was prior to having lost their teeth. That's a process. There's no magic bullet. There's no magic solution. There's no teeth in 24 hours that's going to solve the problem overnight. That's all just marketing tactics to get you in the door. So what I'd like to do is look at a case that we actually did from start to finish. So patient comes in, and I've shown parts of this case before. A lot of these cases I will show them. I have thousands of cases, but some of them just have so much to show. Oftentimes they're very extreme, and so I like to kind of show that worst case scenario so that patients can really understand that most of the time they're not, most patients don't have it this bad, right? So what we're looking at here is this is a patient who is a hardworking individual that is, just doing the very best he can, but for whatever reason started to kind of neglect his teeth. And I think it's really a matter of a couple of things. One is possibly fear, and then two is just a lack of understanding of what happens. If I were to just stop brushing my teeth and just stop maintaining them, I would end up in a situation just like this. So
Doctor, quick question.
Yeah.
That previous image that you showed, I know you just mentioned that, if we neglect our teeth, we don't brush, How does one develop that? Like, what causes that?
Yeah, thanks, Memo. That's a great question. So if you'll notice all of this buildup, so this dark area here, that. So let's first look at the body of the tooth, which is the enamel, the white part. Notice how there's not much of the dark or the calculus, that tartar buildup on the enamel. It's all on what we call the dentin. So the crown of the tooth, that's, for somebody that has perfect gum tissue, perfect teeth, they maintain their teeth, you'll just see the enamel part. You won't see the dentin or the root part of the tooth. The structure is very different for each. So and the only reason I bring that up is the enamel tends to kind of push away and not adhere the bacteria. Tartar doesn't adhere quite as tightly to the enamel. But once the dentin becomes exposed, so once the tissue, the bone, the gingiva starts to pull away from the enamel, now all of a sudden the root or the dentin is exposed. And so once that dentin becomes exposed, now all of a sudden it's a nidus for adhering bacteria, adhering tartar. And once that's exposed, it runs really fast. So if the patient continues to not maintain, brush, floss, irrigate, or remove the debris that's now on the exposed root or dentin, that bacteria or tartar or calculus just binds to it really hard. So, and in fact, they're really hard to get off. You would not be able to just use a toothbrush to get this brown tartar material off. It's next to impossible. So you'd have to either go see a dental hygienist or a dentist or somebody that would be able to remove it. Now, as we look at this, so this is, if it were just a little bit of the calculus buildup and we didn't have it running up so far up along the tooth, you can save that. Like, you could technically save the tooth and not lose all these teeth. But because it's gone so long, and if you'll notice, it's running all the way up the length of the tooth. So all of this brown and dark area, that tissue's all gone. The bone is gone, the gum tissue's gone. And in fact, as soon as I cleaned off this calculus or tartar, the tooth was loose. So the only thing holding the tooth in place was the debris. So, so this is an extreme case. And then this big granuloma, this big piece of tissue, I mean, that's just harboring bacteria that's just been sitting there for years and years and years. I actually cut it out prior to doing all the extractions because I wanted to do his surgery in a cleaner environment. So I wanted to clean all this up a little bit prior to doing the implant surgery. Then the other thing I want to take a look at is, all right, so we can kind of see all of that's going on here. And I think we can all agree that there's nothing left here to save. These teeth have to come out. We can look at x-rays and we can kind of visualize, this is more like for the if we have any dentist viewers, the periodontal disease or the bone loss around all of these teeth is so far gone that there's not anything left here to save. Even though he has all of his teeth, he doesn't have one tooth that's missing. But because of years of just not maintaining it and, we'll say neglect, we had to pull all of his teeth out. So, and some people will ask, okay, so what's the big deal, right? I mean, so I lose all my teeth. What's the big deal? Well, until so you have patients who have teeth, so they're what we call dentate, they have teeth. Edentulous is they have no teeth. And so if we take a patient who has their own teeth, even though like in this case, they're not in great shape, and we take them and remove all of their teeth, now all of a sudden they can appreciate the value of having their teeth. Because prior to this, they didn't. They just thought, well, I'll just pull my teeth out, and a lot of times the neglect comes just merely from a lack of understanding what it means to have lost your teeth. So, and again, losing your teeth is like losing a limb. I mean, you are very handicapped in so many aspects. And probably one of the main critical aspects is the fact that you just have lost all of your confidence, And so, anyway, so we went ahead, and I think we had actually kind of showed some of the video, but, here's some video of the process of, pulling these teeth out, and notice they're coming out easily, like no, sometimes teeth are a little harder to get out, but literally with a small rotation, these things are just popping out left and right. So, but the key here is notice as I'm extracting these teeth, I'm rotating, and I'm feeling the buccal plate or the bone to try to I don't want to lose any bone here. I want to try to maximize the bone that I have left. As I pull the tooth out, you notice there's large like granulomas or infections connected to the teeth themselves. And so this might be a little graphic for some people, but my point is these teeth came out very easily, and here I'm just degranulating. I'm cleaning up these sites, making sure I get all the infection cleared out, and now I'm grafting the sites. And so this is a delayed procedure where I pulled the teeth out, and then degranulation, irrigation, sterilization of the bone, clean it up, and then rebuild that bone. So in some of the corporate all-on-4 centers, they will cut the bone down about 7 to 10 millimeters to gain space for the prosthesis. To me, the bone is very important. It's like gold. I want to save it. I want to preserve it. I don't want to, I don't want to remove any bone. Sometimes I'll contour the bone very slightly. Just if there's a sharp edge, take a Rongiers or an instrument and just very, very gently smooth it off, so that it's an even ridge, but I'm not cutting it down 7 to 10 millimeters.
Why do they cut it down that much?
Yeah, so that's a great question. So the reason that and that's called an alveoloplasty. So the reason that they'll section or cut that bone down is because most of the corporate all-on-4 centers, they are making a plastic set of teeth so that you have and I've said this 1,000 times, but it's the truth. So with the all-on-4 procedure, they use a titanium framework, and then they use plastic resin teeth over the titanium bar. So the bar provides some, because if it was all plastic, it would break without a doubt. So the bar provides some, mechanical support, but in reality, it's plastic denture teeth with plastic resin, the pink. And so they need to cut the bone down in order to create space, in order to create enough material so it's strong enough to withstand the loads of the bite force. So the alveoloplasty is what they do, where they cut that bone down, and that will give them more room so that in the final prosthesis or the final set of teeth, they have a little bit more strength, even though, I haven't done what's called a hybrid titanium bar framework with plastic teeth for 15, 20 years. I don't even remember the last time I did one. But so we'll use zirconia, but more importantly, I've maintained that bone so my prosthesis is a lot smaller. It's more in tune. In fact, you can see here's his case completed, and this is actually just a temporary, but I haven't cut down the bone at all. He's got 8 implants rather than 4. And so he's got a more solid foundation. One thing I wanted to look at as well is, what does it look like? And this is a cross-sectional view x-ray, so bear with me as I kind of walk through here. So So this is the canine. This would be tooth number 6, upper right-hand side. And the tip of the tooth is right here, okay? So that's the tip of the canine. And then the apex or the tip of the root, up here is right here. The level of bone supporting this tooth should be, about, and I don't know if you can see my cursor, but it should be about right here. So I've lost all of this bone up to the tip of the root or the apex. So when this tooth comes out, when I pull the tooth out, you'll see this little peak of bone here. That's all that's left. And so obviously if I'm going to try to place an implant in this site, there's not a lot of bone. So I need to regenerate this bone. That's why when I showed the video of the extractions, I pulled the teeth, cleaned up the infection, cleaned up the sites, and then rebuilt the bone back up rather than try to place implants immediately, which I do all the time. In fact, on his lower, I pulled all the lower teeth out, cleaned up the bone, and placed implants at the same time. So now let's look at what this same site looks like after having regenerated the bone and placed the implant. And so here's same area, cross-sectional view. Bone is now, and it's hard to see because I can see this, but because it is an X-ray or cross-sectional view of a CT scan, I've got nice thick bone out here on the front part of the implant, and then there's a sinus lift. Patients will ask, they've been to other doctors, had second opinions or whatever, and the doctor will say, well, we need to do a sinus lift. And so you'll see this little ball of bone over the apex or the top of the implant, and that protects the implant from being inserted into the sinus. The sinus is actually pretty dirty, and so if I have a barrier between the tip of the implant and the floor of the sinus, then I'm not in a situation where the apex or the tip of the implant can get infected or become a chronic infection for the patient. And so,
Doctor, we have a question from Kimberly Morris.
Yeah.
Said, good morning, Dr. Willardsen. Glad to be here.
Good morning, Kimberly.
So which prosthetic materials or material do not gather excess buildup or plaque?
Oh, that's an excellent question. So, now the question is what? So Kimberly, let me step back because let's look at, this is his final this is a panoramic view from the CT. Implants are all in place. Again, I did not do a major reduction of bone. Bone levels are pretty much the same, other than they're just a little more even as they were when I extracted the teeth themselves. So then the question is what prosthetic material adheres the least amount of bacteria, because that is an important part of this process. One, we're putting a artificial material in your mouth. One, you have artificial anchors, implants, that are now integrated into the bone, and we're using artificial materials to attach to those implants to replicate the teeth that have been lost. And so the question is what material, I'm going to rephrase it, because what material adheres the bacteria more, and it's plastic. As you can imagine, plastic absorbs, and it's in a wet environment. Our mouths, obviously, it's in a wet environment, so it absorbs just the fluids. It absorbs bacteria. It adheres bacteria. So these hybrid, the prostheses that you'll get at these choice clear centers that are plastic and titanium, that is going to adhere a lot more bacteria. Plus, keep in mind, they've removed 10 millimeters of bone, so you have a lot more material that's going to adhere more bacteria and more difficult to maintain. So there's so many variables and so many factors that for patients, they go into some of these centers just going, okay, I want my mouth fixed. I want implants. I want to have a smile again. But on the back end of that, and and of course they have no idea really what the plan is that they're getting or that the doctor's going to do on them. And so, Kimberly, to answer your question, zirconia does not adhere bacteria, plaque, tartar. It's much, much less than the plastic type of prosthesis or the hybrid that 99% of the doctors are using nowadays. So, and that's an important point because at the end of the day, maintenance is key. If once a patient goes through this procedure, they have to maintain it. This patient, here he is with the implants in place. And again, we talked about this, I think, last week. If he does not maintain it and ends up with this sort of habit or pattern of maintenance, he'll lose the implants as well. So it's really important that it's maintained, and then it's important on my end to provide him with a prosthesis that is easy to maintain and also does not adhere, using materials that don't adhere such amount of bacteria. So,
perfect. And we have another question here, or comment and question. I'm just going to shorten it for them. They're pretty much saying that they've been watching the show on TV that we have running for a few years now, but the only thing that's stopping them is fear. The fear of coming in and not knowing, and if it's going to be painful. And I know we get it, right? Like, we all have that fear to go to the dentist because we don't know.
Yeah, in fact, one, I have a lot of compassion for these patients because in reality that was this guy. He was just deathly afraid. I remember when I first kind of even just started approaching him with just in discussion. Like, I wasn't, I looked in his mouth and of course took the CT scan and some x-rays and stuff, but man, even as I approached him, he just started sweating. Like, I hadn't done anything. And so immediately I knew this was a case of, obviously there's some neglect here, but the neglect stemmed from fear. And so, again, 85, 90% of my patients, especially that are in this sort of a situation, it's fear-driven. They are deathly afraid of coming to the dentist. They're afraid of having the thought of having teeth pulled, the thought of having implants placed and bone grafts. But then they get to a point where they're like, well, now I have no choice. So the way that we manage that, of course, is with on our YouTube channel, we show general anesthesia is a big part of our practice. I mean, we have a board-certified anesthesiologist on staff, so. All of these cases are done under general anesthesia, so the patient's asleep. So and how that works is we do what's called a nasal intubation, so the tube will go in the nose rather than in the mouth. Like if you were to have your, a kidney or like a gallbladder removed or any sort of anesthesia in the hospital, they'll go down your throat, whereas we go through the nasal intubation. Very safe, effective procedure, and also at the time of anesthesia, I give local, so there's no way the patient's going to feel any pain at all. So they're under general anesthesia using the medications that we use, plus I give local anesthetic, so it's just a much, much more comfortable environment and very safe environment so that they can get the work done that they need to. Because honestly, like I said, 85 to 90% of the patients that come in, that is a big part of them not having fixed things in the beginning. They're just afraid of, they may have had bad experiences. In dental school, one of the classes we had to take, pedo class, which is little kids dentistry, which they would teach a technique called the hand over mouth technique. And what that means is you just put their hand over the mouth of the kid to the point where they're freaking out, but you cut, which I was never really for one, I've never done it. But two, the fact that they had to teach this technique, hand over mouth, cover the kid's mouth and get him to calm down or somehow, get them to the point to where you can work on them. And anyways, so that's where anesthesia just comes in. It's very effective. And at the end of the day, there's no real need to be afraid of this, because on the other side of it, I mean, there is a need to be afraid because it is a process. It's not like it's walk in the park, because it is a process. And I'll never say that it's every case is just so easy and come in and then in one day you're going to have your teeth and you're just going to be happy and it's going to be all unicorn and rainbows. But that's not the case. It's a process. It takes time. But when it's done, it's an absolute game changer. So we can, and I think I've shown this video, but this is very, very typical of, it's very typical of patients who, like in his case, and you saw his pre-op photos, and now here he is, and these are actually temporaries, they're not even the final. And so you can see his life has just changed. It's a game changer. It's night and day. There's just no comparison to where he was when we started to this point here, where now he's got the implants in place, those bad teeth are out, the infection's gone. With that amount of infection, I mean, and maybe some lifestyle and habits, he runs the risk of having cardiac disease, hypertension. There's a lot of things that can happen just because your body is fighting that bacteria in your mouth. That's all gone. His smile is restored. His confidence is restored. So, there's really no way to put a price tag on what this offers and what this gives to patients, which kind of leads me into, we get a lot of questions about the cost, and we, of course, and you'll see ads for grants. What is a grant? The grant is, we offer grants here, but basically it's just we reduce the cost of the case, try to get it in a ballpark figure to where we can get as many. There's certainly, costs to do these cases. There's the overhead to do these cases is very, very high. So it's an investment. It's something that it's only for people that truly want to improve their lifestyle. If they're in this sort of a situation, his options, in fact, there's a viewer here that asks, what other options does he have? And his options are either, because the teeth have to come out, we can see that. He either wears dentures, takes the teeth out and wears dentures, or he gets implants. Those are his only options. Some patients are fine with dentures, just pull the teeth out, wear dentures. He had to wear dentures for a period of time. In fact, we show the photos of, here he is, he dentulous, no teeth. Teeth are out, bone grafts are healing, implants are healing. But he suffered with dentures for 3 to 4 months, I think. And I know he wouldn't want to stay in that situation, right? I mean, having teeth that are coming out. In fact, there were periods of time where he just would not wear them at all. So,
yeah. And I would say too, doctor, that I guess going along with like having fear and not knowing the price and the cost, just like go find out. Like you don't have to do it right away. Like book a free consultation. There's places that do charge for consultations, others do virtual, but just takes the steps to get you towards that smile that you're looking for. Like you don't have to go and get the treatment right away, but we have a YouTube channel where they can go and educate themselves. They can do their own research. So that's going to get you, 1 or 2 steps closer, and then the fear is going to decrease because now you know more.
Yes.
So
yeah, and that's a great point, Memo. The fear a lot of times is driven by the unknown. When we talked last week about, going through this process, it's kind of like flying to the moon. Until you've done it, you have no clue what it feels like, what it's going to be like, what problems are going to arise. And like I said, I've done it so many times on a person, but I've never had it done to myself. So even I can't fully relate to what it feels like to have all my teeth taken out. But what I do know that at the end of the day, when these cases are completed and we've put the final, set of teeth in, implants are integrated, and we're torquing everything down. And now all of a sudden, the patient, once it's torqued into place, and he feels like, oh, wow, this thing is solid. I can bite down and then look in the mirror like, oh, my gosh, my smile is restored. That light that I have in me is now restored, and I'm not just looking at, somebody that I don't recognize because I don't have my teeth anymore. So, these are all factors that add to the value of this process, and help patients understand that it is an investment, but it's an investment in them, and it's worth every penny. And the other option, again, like I said, is if the patient's losing all their teeth, is basically dentures or implants. So
yeah. Also,
and then the type of prosthetic, the design, placement of implants, number of implants, all of that plays into, and it's such a critical part of the process.
Yeah, I was also going to say that one thing that I don't know if other places do it, but we definitely do here is when new patients come in, if they want a list of our old patients, which they can call, and then these patients can let them know the process. Like, they can ask whatever questions they have to these patients, and they're happy to answer. I mean, they're happy to do these testimonial videos for us, so they're also happy to answer any questions if you have any doubts. Because like Dr. Willardsen said, like even myself or him, we haven't been through the process, so we don't know exactly how exactly works. Like, he's done a lot of cases himself, but talking to someone who's gone through the same process, who's been there, who's experienced everything, it's a lot better. Like it helps with that fear.
Yeah. Oh, absolutely. So, talking with someone who's been through the process, and just arming yourself with as much information as you can, so that when the time comes and you're ready for taking that next step and making the move to have this procedure done, it's a life-changing procedure. It's one of the best decisions you'll make for yourself. We're happy to have you talk to any one of our patients who've been through it and can kind of guide you through it. We actually have a concierge that has been through the process that is on call, basically. I wouldn't say 24/7, but you can talk to her at any time. But not just her, but and her name is Robin. But we have many, many, many other patients who are part of the family. I mean, it truly is a family here. Our patients, once they've committed to us as their, the center for their reconstruction, we give 150% and are all in to help them get the very best end result and predictable long-term outcome possible. We don't just put everybody in the same box and do all on 4 on every single person and do resin-wrapped hybrids on every patient. We do what's right for the patient so that at the end of the day, when this is all done, their investment is secure. And that's always my goal, is to make sure that when I get paid for a job, that I know that this job is going to be one that's going to last them. Yeah. And the all-on-4 just doesn't provide that. There's lots of complications that come along with it. And in reality, it's just not enough support to support that many teeth. Or they eliminate teeth to minimize the number of teeth to minimize the load factor. So
we have a couple more questions here.
Yeah.
How important is hygiene after a dental implant procedure? Are dental implants like natural teeth?
Another great question. Hygiene is very important. So when we look at, for example, let's look at kind of a profile view here of our patient. So here he is, teeth are in place. He's got, aesthetically, they look great. Lip support is good. Phonetics, the way he talks, his speech is good. The occlusion, the way the teeth come together, the articulation or mastication, the way that the teeth function and chew is good. All of those are factors that I control, right? I'm the one in charge of making sure that I hit all my marks on every case to make sure that every single technical detail of the case is done to the very best possible. The only thing that I cannot control is hygiene. I can't come to your house. I can't come in the mornings and brush your teeth for you. I can't be there at night and brush your teeth for you. I can't, I'll help in any way I can, instruct, guide, support. If I like to, like on this case or any case, I want to see the patient after delivery, 1 month later, then 3 months later, and then 6 months later, and then a year later. So I know that the patient has developed some habits that will make sure that the investment that they've made and the heart tissue that I've burned to make sure that this case has gone perfectly, and every step that I've taken, that it's preserved and maintained. Because I invest a lot in all of these cases. I don't sleep at night a lot of times because I want to make sure that every single patient gets the very best outcome. But again, I cannot go to their house and brush their teeth for them. So maintenance is very, very, very important. Having good changing habits, like in this case, he had to change his habits, and he's doing a great job. He really has, because he's made the investment, he's taken the time, and now he's on the road to recovery, so to speak, and on the path to, my mouth is important, my teeth are important, my smile is important, my ability to chew is important. I've suffered with dentures. I know how horrible that feels. And now I have something that's secure. When I bite into something, I have that security. So he has actually done a 180 from when I saw him originally. You guys saw the photos of, when I first saw him, and how, unfortunately the neglect was pretty severe. And now when we look at, and I think I have photos, intraoral, maybe not. Anyways, the gum tissue itself now is very clean. Bone levels around the implants, very, very good. Grafting correctly, not cutting the bone down, implants in a proper position. All of these factors play into the long-term viability and success of his case. And then all he has to do is maintain it. That's all he's got to do, is just brush, irrigate, and maintain it. And he's doing a good job at that. So that's a very good question, long-winded on my end. And what was the second part they asked?
Are implants like natural teeth?
Are implants like natural teeth? No, they're absolutely not. And they're an excellent replacement for natural teeth, but there's nothing like our own natural teeth. Again, I've talked about this in the past. There's something that's called proprioception. Proprioception is when, like, let's say, for example, you're eating something and somehow something hard gets in there and you bite down, the automatic reaction when you bite into something really, really hard enough to break the tooth, is to pull back. And so that's proprioception. Or when you get a popcorn kernel stuck in between your teeth, that's proprioception. You want to get that out as soon as possible. You don't want it staying there. It's just, our body's way of trying to maintain our teeth. And so implants do not have proprioception. So when you bite down into something, if there's something hard in there, you're going to bite right through it. And, you can break the prosthesis if you were to not, pull back, or you to bite on something really, really hard. So implants are not like teeth, but they are the best thing we have to replace lost or missing teeth.
Okay, one more question.
Okay.
What would last longer, dental implants or a denture?
Well, a denture is basically just false teeth that comes in and out. Dentures, they can last 5 to 10 years. Just depends on the case. But dental implants, without a doubt, are going to last longer, for sure, as long as they're maintained properly. No doubt about it. once a patient has implants, if maintained properly, and most importantly, if they do not smoke, if they smoke, and that's an important topic, if they do smoke, it's kind of it's anybody's guess as to how long they're going to last. Some cases I've had patients that, I've done, 15 years ago that have never, ever stopped smoking. Case still looks great, but their hygiene is impeccable, like really, really good. Thinking of a couple of patients. Other patients have same thing, smoked, never stopped smoking. There is a smoking cessation protocol. It's 2 months before surgery, 2 months after surgery. That's 4 months. So at that point I figure, you know what, just stop smoking. But I can't relate, but I think that's a lot easier said than done. But so smoking is a big factor in implant success or failure because smoke binds oxygen. The oxygen is what heals the tissues in the mouth and fights off bacteria and infection. And so smoking just creates an environment of a hypoxic or a very low oxygen environment. And so it's like constantly fighting to stay healthy. And so patients that smoke will see a higher failure rate without a doubt. And we tell our patients, if you're going to smoke, a lot of times we won't treat them usually, but then there are some cases that have come in, they've already received implants or we're kind of in the process and they just will not stop smoking, but they do need their mouth reconstructed. So we just make sure they understand that, if you understand the risks and that smoking is a huge risk when it comes to implants, they have to understand that. And I've said this again in the past, if you were to have a hip or a knee replacement or any sort of an implant placed into your body, the surgeon would be adamant about no smoking. And so that's an indirect effect because it's indirectly affecting through the bloodstream the surgical site and the prosthetic, whereas with dental implants, smoking is a direct effect. So it goes directly to the area, the surgical site or, whatever it is, especially if they smoke right after surgery. And we've seen that in certain cases. So again, long-winded, but really important to know that that is a big risk.
And I have one more here. This is very good. It's kind of long as well, and there's multiple questions within the comment. This person's saying, I think you're very good, but I have a question. How many full mouth rehab cases do you do per year? That's question number one. Also, would you be able to share the cost for the full mouth rehab since you use Noble BioCare implants and Zimmer bone graft, gold standard? I figure your overhead is really high. I mean, I think definitely worth it, but at what cost? Wow.
Putting me on the spot here, but I appreciate that. Okay, so what was the first part of the question?
It's pretty much how many full mouth rehabs.
Oh, okay, how many full mouth rehabs do we do a year? Gosh, I really have no clue. I would say full mouth reconstructions, we probably did last year about 500, I would imagine. Implants, we placed about 1,700 implants, but there's a full mouth reconstruction can vary in the number of implants. So I don't know exactly, but I would imagine that's about what we did last year. And then the second part of the question was...
would you be able to share the cost full mouth rehab?
So the cost can vary, but let's say, for example, somebody who were... Now, we talked last week about cases where I've kind of picked them up from other doctors and I'm having to do a workaround and kind of redesign, basically reconstruct the case and redesign the case and rebuild the case on a foundation that I didn't develop. That can be much more expensive because I'm having to work around some variables that I had no control over. on a patient who comes in clean, where they just come to me and they start with me and I take them from A to Z, the cost roughly for a full mouth rehab with all the extractions, bone grafts, implants, prosthetic, 6 implants on the upper, 6 on the lower, varies between 60 to, I'm going to have to say $75,000, depends on, and that's, again, using minimum of 6 to 8 implants. If it's sinus grafting, prosthetics are made out of zirconia. A lot of stuff that goes into that, extractions, grafts, provisionals.
Also, I would say, you've talked about having an anesthesiologist in-house, you have surgical assistants, all these things that people don't, just to get that surgery done, you have all these parts that go around, the cost as well.
Yeah, so the cost is it's an investment, no doubt about it. And for some people, that is completely out of their range, and I get that. And for some people, they're okay with, going to the Choice Clear Centers that have special of the week where they're doing a full mouth of just 4 implants for $45,000 or whatever the case may be. But I know that I'm giving so much more because, one, they're getting more implants, better prosthetic materials. There's so many variables and factors that the patient doesn't really understand that goes into the case that kind of add to the cost. But at the end of the day, to me, it's that building something that's on a foundation that's going to last, So whether it's $40,000 or whether it's $100,000. I'm not saying that's what the cases are going to be, but there's a range in there for each patient, and there's, it's just a matter of what is going to be best for the patient. Of course, we do have payment plans and financing and all that sort of thing, but it is an investment, and that's never going to change. There's never going to come a time where there's Medicare is going to pay for this, or it's going to be done through the government, or even if you go to the VA, at one point they were maybe providing an implant here or there, but certainly not a major reconstruction where the whole mouth is being rebuilt. There's just no way that, it's basically a out-of-pocket kind of situation. And most patients will use financing, and they'll finance it for, we have companies that will go out 10 years for financing. So cost is always an issue. It's always the barrier of entry. But for those patients who understand the value, the cost is always, of course, it's an issue, but it's not the main issue. The main issue is getting them what they want, restoring their lives, restoring their confidence, restoring their smile, restoring their ability to chew, eat, their digestion. So much is restored. And impossible to put a price tag on it. I think it's worth $1 million, to be honest with you, and it's a bargain.
Yeah, kind of like what you're mentioning, it really comes down to what the patient values it at. What do you value? Your confidence, your being able to eat again, being able to smile. What is that worth for you? And then it could be worth, $45,000, $50,000 at an all-in-4 center, or, if you really do your research and dive more into it, you pay a little bit more, but now you
get a lot more.
You invested into something else. Yeah, it's just with anything else, right? You can buy, they have products or services or things that the price ranges from a very low end to a high end, and you have people who pay the high end price and people who have the low end price. Why? It's because they understand the value of that product, or that service, I would say.
Absolutely. And the value comes once and again, this is kind of why I feel this community that we're creating is really important, because if patients can come into this well armed with information and pretty well educated, nobody's going to pull the wool over their eyes, and they're not going to sign up for something that they don't really know what they're getting into. And so, again, not to say that because I physically, it's impossible for me to do all cases, and there's plenty of great surgery centers out there that know how to do this. But coming into it educated with plenty of knowledge and asking the right questions is going to give you a much better value on the end product. So, and that's, I feel that we're, I'm trying, and that's why I say, ask questions, send in, if you want to send direct message, x-rays, ask questions about your case. We're happy to do so. Whether we do the case or not, that's not what we're concerned about. We're concerned about giving patients the proper guidelines, information, instruction to help them make a good choice and decision on if they do this process. So worth every penny, very, very great investment, and something that will, restore something that's been lost, and it'll restore it in the very best possible way. And so, for me, it's I love being part of the process, and I do know that it's for patients who have been or going through it or been through it or finished with the process, they would say the same, that it's worth every penny.
Yeah. One thing that I was just thinking about is, if you guys really want to know the value, is ask someone who already has a perfect natural smile, and if they lose their teeth, ask them how much they're willing to pay.
Yeah,
to get their smile back. And I mean, I would pay the same
right?
price. So
yeah, imagine, imagine if you lost all of your teeth. What would you pay to have that restored to as natural as possible? I mean, literally, I would pay $1 million if I had to, in order to restore my smile back to what it was prior to losing it. So, but every patient's different, every case is different, and we adapt, and we try to get as many patients what they need as physically possible. But there is a price that comes with it. It is an investment. We do. Financing is a big part of it, because most people don't have that kind of money just laying around. But, over a 10 years period of time, paying it off, plus getting and restoring that aspect of your life is invaluable. And so, anyways, I'm Dr. Willardsen. Thankful to have Memo Hea here with me, and we hope that you enjoyed our live stream today. Again, hit that subscribe, that like button, ask questions, and it helps us to know what we need, what the audience, what the viewers want to know about regarding these topics, so that we can grow this community and help the implant industry change, because it has to change. The way that it is right now, it's kind of like cattle. Everybody's being forced into one thing, and we're kind of going in a different direction. We get a lot of pushback on that for the people that are part of the process of going in the other direction and just doing the all-on-4. But there's a better way, and the all-on-4 has only been around for maybe 10, 12 years, whatever it is, and we've been doing this a lot longer than that, and more effectively than that, much, when it's planned according to the needs of the patient. So anyways, I digress a little on that, but thank you guys for watching. Tune in next week, Wednesday, 9 a.m. Pacific time, and from the beautiful city of Newport Beach. We'll see you next Wednesday. Thank you. I'm Dr. Willardsen with Memo Hea.
Thank you.